All right, so you can all see the first page.
What the document is presenting, but you can take position. This
All right. So I think we can now start. So, like I was saying earlier, lymphedema is basically chronic swelling of the tissues that happens when your lymphatic system is impaired. If you get any issue with the lymphatic system, whether with the vessels, whether with the valves, you're going to have lymphedema. And the sad bit about this condition is once you get it, it is chronic. There is no really cure that is there that will take it away. So most of the management that we do is just to improve someone's quality of life. But it helps so much because once a person enrolls on a program, they get to be much better. So that is basically what lymphedema is. I think on your presentations, you can see some of the people we have worked on and to some of the extent how far this condition can go in damaging tissues. So this is, you can see there is a before, there is a after when these patients came, and then shortly after they joined the program. So what are the causes of lymphedema? I know we are medical workers, so we already know quite a bunch. Heart problems will cause you chronic swelling. Liver issues will cause you chronic swelling. Kidney issues will cause you chronic swelling. But these are just the common ones that we know. There are also traumatic incidents. If someone gets an accident, probably they get a huge cut or their limb is cut off. When these lymphatic vessels are rebuilding, they don't rebuild back the original structure. It's more of kind of a rough rebuild with scar tissue and all that. So they are definitely going to have issues with their limbs. Cancer patients undergoing radiotherapy, they also have this issue a lot. And if you pass through the Cancer Institute, you will see so many people. Some even have to the extent that their abdomens are swelling with fluid, the limbs are swelling, the arms are swelling. So cancer patients are also other people who have lymphedema commonly. And then the most neglected people we have in Uganda are those who have a condition called podoconiosis. Podoconiosis, in simple terms, is a condition, is a type of lymphedema or a type of secondary lymphedema that usually happens in places with volcanic soils. Those volcanic soils have some minerals. They have silica, they have aluminium, and so many other small chemical minerals in those soils. What happens to these people is these people are mostly into farming. So you realize that people in rural areas, they're not so fond of using shoes while farming. So how does podoconiosis come about? It is due to repeated exposure to those minerals in the volcanic soils. So what happens is a person is moving barefoot, so they are going to get small cracks on the feet. It is through those cracks that these minerals or these aluminium and the silicas access their lymphatic system, and then it's a continuous or repetitive kind of process of inflammation over and over again, daily, today, tomorrow. So over the years, the lymphatic system gets completely damaged. It starts from the vessels, it starts from the valves, to an extent that these vessels can no longer send fluid back and it just pulls in their legs. So podoconiosis is one of the causes of lymphedema. We also have the common one which we know, which is filariasis, where you get a filarial worm in your vessels and then you get that big swelling in the legs. So after knowing the causes of lymphedema, this is why it is very important as we are assessing the patients that we have to be sure what is this patient's particular cause. You may start with the therapy, the decongestion therapy, the massaging, the elevation. but when you're not targeting the root cause. That is why, as we always start these camps, we make sure to have machines that check pressure, if a person is on any medication, if they have ever had any traumatic incident, or if they are a cancer patient, or depending on where they're coming from. Now this is where geography becomes important. Like people from Kamwenge, we will know that these people who are coming from that side, it's mostly podoconiosis that is the cause of their lymphedema. We will know that someone coming from anywhere around a volcanic area, those sides of, I think, Mbale, we also have some people there, we'll be sure that their cause of lymphedema is podoconiosis. So those are just some of the causes of lymphedema. And I think you can see a little bit more of pictures there. A little more of the pictures there of the extent of this condition. Then we are going to go to the next slide of what makes this condition very difficult. Now, someone may say that I rarely see these people in public, or I only come across them in streets. Why is that so? Most of these people, their condition gets out of hand due to very few reasons. One is stigma. These people are stigmatized so much. Even us as medical health workers, you're not going to see a person with lymphedema and the first thing in your mind is, let me help this person, because our knowledge is a bit narrow concerning that condition. So most of these people are stigmatized, they are cast aside. When they show up at hospitals, the best that health workers know to do is elevation. And maybe some who have a little bit of background in physiotherapy can also do the compression, but usually that is not enough. Secondly, these people resort to a lot of witchcraft. I think we've all heard the word Etalo. So someone will always say, Bamoroge Etalo. The first place they are going to go to is the witch doctor. The witch doctor doesn't know what he's doing. Obviously, by the end of the treatment they are going to go through the witch doctor, this condition is going to be 2-3 times worse than when they came. So this is why we came up with a campaign a while back that was saying that Etalo Sidogo, because it is not witchcraft. It is a condition that can be treated, and if it is in a chronic stage, it can be managed. Most of the reasons why patients claim to think anyone who comes to hospital with this chronic leg swelling dies is because most of these people come with very advanced cases of this disease. People have DVT, which is also, by the way, another cause of lymphedema, venous insufficiency. People are having clots. By the time they come to the hospital, these clots have already moved to bad areas, and obviously 1-2 weeks of treatment, this patient may pass on. Other patients come with very terrible cellulitis, which is also another cause if it is not addressed earlier. And by the time they reach to the hospital, they are already going into cases of necrotizing fasciitis. They're already going into amputations and all that. So definitely when they get to hospital, these things might get 2 times as worse. Other people have underlying diseases that are not addressed. So by the time they come to the hospital, it may be little or nothing that we can do to help them. But that is not true. If we help these people, we approach them in the community, we put this knowledge that we are sharing here out there, and these people actually know that this is something we can help them with, I'm very sure we're going to avoid the extremes of lymphedema. So maybe the one thing I had forgotten about to talk about in among the causes is that lymphedema, you can also be born with it. You can have congenital lymphedema, whereby a baby is born with a very swollen limb, baby is born with a very swollen arm, because they are born with an already impaired lymphatic system. One of our patients who we got in the last camp was a very young boy. He was born with it, but the leg was so huge that this boy was bound to a wheelchair. However, if these people had started this therapy earlier on in life, this boy could have been walking, this boy could have been having a more comfortable life. And by the end of those few 4 weeks we were with him, there was a very drastic change in the size of his limbs. So On the next page, I think you can all see the causes. I think I've tried to tap on each of the causes. I've talked about the podoconiosis. I've talked about the filariasis, or commonly known as elephantiasis. I've talked about the trauma or surgical issues. I've talked about the venous insufficiency, the liver heart diseases, the congenital anomalies, etc. So now we're going to the vicious cycle of lymphedema. What makes this disease very hard to cure? One, when your lymphatic system gets impaired, now like for the causes that we have mentioned above, like through podoconiosis, when you're getting continuous irritation, what is going to happen is you're going to start having fluid pulling up in the tissues. When this fluid pulls up in the tissues, what is going to happen? Remember, our lymphatic system helps us to take away wastes. It also helps us in carrying white blood cells to where they're needed. That's why we have those areas that have lymph nodes. So it has a lot of issues. So now what is going to happen when these wastes are pulling there? Remember, it is waste tissue that needs to be taken out of the body. Now, if it is pulling, it is going to continuously irritate the tissues. It is going to continuously irritate that area. When it continuously irritates that area, it is going to get what? Inflamed. So now, already we have tissue there. Already you have fluid there. Already we are getting continuous inflammation by the presence of the tissue itself. I don't know if you understand what I'm trying to say. Am I clear enough? Yeah. So already we're having the irritation, let's say from the silica soils, or maybe someone had a traumatic incident. Already there was irritation there. The nodes were damaged. So now we're having pulling of tissue. The pulling of fluid. The fluid that is pulling there has wastes in it. The fluid that is pulling there has also some white blood cells in it. So we are having a vicious cycle of, we're already having damaged, but what is being kept there is also causing further damage. So what is the body going to do? The body is going to try and repair, just like any other place where you can get a wound, where you can get an injury. The body is always going to send there its cells to try and repair the tissue, to try and rebuild it. But most of the times what it rebuilds is not always exactly as what was there. So now that the irritating factor is not moving, remember when you get like a cut on your skin, usually it's a cut and it's done. But now imagine if it is continuously cutting, your body is trying to repair, but the thing that is cutting you is not stopping. So this is the same analogy I want you to think of when you think of lymphedema. The tissue, the fluid has waste in it, the fluid has white blood cells. It's supposed to move away and be taken out, but it is not moving due to the already damaged valves, due to the already damaged vessels. The body is going to keep trying to rebuild. It's going to keep trying to rebuild. It's going to try and keep sending fibroblasts there. It's going to try and keep sending collagen there. Collagen is the protein that helps us build basically almost all the major tissues in our body: the nails, the skin, the hair. So the body is going to try and keep repairing. But remember, the aggravating factor is not going away. So what happens is these vessels, the skin is going to become hard, very hard. You will notice with some of the patients, God willing, if we have a camp here, some of the patients who come have a skin that is hard as rock. It is because of this repetitive inflammation. The body is trying to repair, but the aggravating factor is not going away. So we're going to have repetitive inflammation, repetitive trying to build, and then what is going to end up is a very tough tissue, a very hard tissue, and a very completely impaired lymphatic system. So I think with that explanation, you understand how vicious lymphedema is. It keeps aggravating its own self. Even if you may have had cellulitis and you recovered, but then you got some damage in your lymphatic system and you get lymphedema, the lymphedema itself is going to keep boosting itself even when the initial aggravating factor is there. Same thing for these people who live around volcanic soils. Even when they move away from volcanic soils, the fact that the lymphatic system was already damaged, they are still having fluid pooling, the condition is going to keep building on itself, building on itself. So I think we have now a clear picture of why this condition becomes chronic. Yeah. So I think we can go to the next page. So these are the stages of lymphedema. I don't know if you can see those pictures. Can you all see them?
Yes.
Yes. We have stage 0, we have stage 1, we have stage 3. Remember, lymphedema can attack all limbs, whether the arms or the legs. You find someone with a very swollen arm, just that those are a bit rare. You find someone with a very swollen arm, some can even get it in the abdomen, a very swollen abdomen. You find someone with a very swollen limb, it can be unilateral, it can be bilateral. So at stage 0, this is where the aggravating factor has just started. Maybe you've gotten a infection there. Maybe you've gotten a traumatic incident. Maybe you've gotten exposed to volcanic soils, and they kind of spoil your lymphatic system. So at this early stage, there is impaired flow, but the swelling hasn't yet started. But already your lymphatic system has an issue. So stage 1, I think you can see the next picture there. Stage 1, now that is when the pitting edema starts. You find someone, they sit for some time, leg swells, maybe they walk from here to there, leg is swelling, and you press the leg, it is beating. So for this kind of person at this stage with elevation, they can kind of manage themselves a little bit. At this stage also still, the tissues haven't yet fibrosed so much to the extent that the skin also becomes hard. So usually at stage 1, if we go to patients at stage 1, this is where we can at least try and reverse that very bad swelling and that skin hardening. Now, once a person enters stage 2, where it is non-pitting, remember here we've been having the repetitive inflammation, the repetitive formation of scar tissue. Now things are hard. Someone has a leg, you come and press on it, it's not pitting, but there is fluid there and the skin is very hard. So at this stage, stage 2, the lymphedema is almost irreversible. Obviously, yes, we're going to manage the symptoms. The leg may reduce, but it may not go back to its original structure. Stage 3 now is the elephantiasis, we all know, whereby you see someone on the street with a huge leg or with both legs and they are so huge and they cannot even lift the leg because it is heavy. You find someone, they weigh, let me say, 90 kgs or 100 kgs, but 30 of those kgs are in the what? Are in the legs because of that excess fluid. So these are the major stages of lymphedema. Now, we as health workers, our major goal, or what we should strive to do, is to try and educate people so that they can come when they are still at stage 1, whereby we can help them reverse. Someone, yes, the condition will still be chronic, but because we have gotten it earlier, the tissue fibrosis will be minimal, and also they'll be able to maintain the original structure of the leg. Yes, they may get the occasional swelling, but if we have managed them properly and we've also taught them, because the goal of lymphedema is not to always have the patient coming to the hospital. Yes, you come, we treat you the first time, but we also teach you to manage yourself from home. So that is our biggest goal, and that is why we are striving to try and educate as many health workers as possible and Ugandans at large, because if they know this information firsthand, we won't be having those extreme cases of elephantiasis. So I think we have all understood the staging of lymphedema. Now we go to the management. Now the management is majorly complete decongestive therapy. But remember, we reach the complete decongestive therapy after first confirming the cause. If it is a kidney issue, first address the kidney issue, the swelling will go away. If it is a liver issue, first address the liver issue, the swelling will go away. If it is a heart issue, first address the heart issue, the swelling will go away. If it is a traumatic issue, try to repair the damage as much as possible. The swelling may or may not go away. If it is something to do with these are the now physical causes I've tried to explain, apodoconiosis, etc. The first thing, before even going into the management, is teaching these people cleanliness, wearing shoes, wearing gumboots, teaching them that temutambulira mu bigere. Move with gumboots. Don't go to the farm with bare feet. Don't get exposed to that soil with bare feet. That's why most of the times when you go to those camps, we always try to donate personal hygiene materials, gumboots, benzines, and all those things, so that these people can practice personal hygiene and also protect themselves from exposure to the aggravating factors. So after identifying what has caused the lymphedema of your patient, now is where we go to the decongestive therapy. After we have removed the aggravating issue, now we can start with the therapy. The very first point there is skin care. You need to have a good skin. Most of these people, you're going to realize that they have skin issues, they have fungal infections everywhere, because at times they even neglect themselves because he doesn't have a solution, he or she doesn't have a solution. So they're going to give up and they're going to get all these skin issues. And also the fact that their lymphatic system is impaired, obviously they're going to get all these minor skin infections that they would have otherwise survived had they had a proper functioning lymphatic system. So the first step is skin care. Washing the leg regularly, at least twice a day, or even 3 times a day now for patients who you may have admitted on the ward, twice a day. Drying it, moisturizing it. If this patient has any fungal infections, we can give them a mixture of both oral antifungals and topical antifungals to help with the fungal infection, and maintaining the skin very well. The major oil we use is castor oil. Castor oil has a lot of anti-inflammatory properties in it. Not only does it make the skin, help the skin recover, but also it seeps into the tissues and helps to soften them gradually as we follow up with these other methods of the decongestive therapy. So the next step after taking care of the skin properly, you've washed, you've cleaned, you're treating whatever infection is there, you're using the castor oil to moisturize and to also give you some pain relief. We are using the compression. Now compression, we have majorly, we use about 3 layers of compression. There's a stock that comes on first, then we have the next layer, and then we have the compression stockings or the compression bandages themselves. What these bandages help us with, they help to press the fluid, to compress that fluid so that it can be pushed away from the tissues. Remember, the way our lymphatic system works is when you move or when you're walking, these very muscles are the ones that help to compress those lymphatics, to push the fluid up, because these lymphatics really don't have anything that helps them to pull the fluid away. So it is our muscles that help to compress and then they push, compress and then they push. But now for someone who has had that chronic swelling, that chronic inflammation, the scar tissue forming, obviously they are not going to have good muscular form. So with the compressions, that is their role. We are trying to push the fluid back up. And even before we do the compression, we do something called vibration therapy. We use vibration guns, we use vibration plates. These vibration plates help to try and reawaken the lymphatic system, try and remove any clots, any stasis that may be in the tissue, in the leg rather. So after the vibration therapy and the limb has softened a little bit, we usually use a massage gun as well to try and soften the tissues manually. After that whole process is now when the person does what? Starts using the compression garments, the stockings, or whichever, depending on the level of or the stage of lymphedema they are at. So after we've done the skincare, after we've done the compression, we also do elevation, and most of all, exercise. Usually you will notice, I don't know if you've seen, maybe the sisters who came at the camp saw some of the patients, we encourage them to walk reasonable distances. You wake up early in the morning, you see people walking around, because exercise, like I've told you, uh, helps these muscles to try and push the fluid up, and then it goes to where the body can push it out, whether to the kidney, whether to the liver, to be broken down and these wastes eliminated. So exercise is a big part of this treatment. Not only that, we also have some trainers who help them through those physicals, to get their legs moving again. Some of these people's muscles have stiffened because of that chronic inflammation they've had. So these exercises play a great deal. Now, the earlier bit I had been explaining is the manual lymphatic drainage. After the vibration plate, after the massage gun, we also do manual massage with the hands and try to direct this lymph fluid. So we usually massage going upwards because we're trying to direct the fluid away from the tissue. So basically, these are the 4 steps, major steps in the decongestive therapy. Remember, the treatment of lymphedema is a holistic approach. You don't just look at lymph swelling and say, that's lymphedema. First, find out what is causing the lymphedema. From something as simple as where a person is coming from can tell you that this place has volcanic soils, or this place they're in a foresty area, this person may have filariasis. So that is why it is important to always have the tests available, the liver function test, renal function test, the Doppler scan, so that you can scan and make sure that it is not filariasis. So basically, that is lymphedema in brief. I've tried to explain what it is, the causes, and basically how it is managed. Obviously, this is not all the information because most of the work is physical. So I know we'll organize a bit of time whereby we'll teach you how to do this decongestive therapy physically, because at the end of the day, we can't do it ourselves. Every health worker needs to know this. So if you get a patient, you would know what to do. So unless there is a question, I would want to invite my colleague to continue from there and explain what we're about and also what we hope to achieve together with you if given the chance. Is there any question up to that point? Yes. Yes, please.
According to your statistics,
Yes.
where are we? Where is podoconiosis more common in Uganda?
Podoconiosis is most common where there are where there are volcanic soils. So Kati, a place like Kamwenge is like a very big hotspot where there are volcanic soils. There are also regions, I think, around Lake Albert, Chisoro,
even part of Rwanda, because the border and all that, then Kapchora,
exactly,
then
Mbale, all those areas where there are volcanic soils.
Like, when we got to know about this condition, we got to know that like, there are very many people who are, who are living with the condition and they don't know. Because when we went to Kamwenge, it may come from Kokoto, so it's close to our place. So we were so concerned with people having a condition that is manageable, but just because the missing gap is knowledge. Because when we went there, we had a camp and we worked on a few, and now they're doing well. Just the missing gap is the knowledge, because the knowledge is available. Because even I think when you check like your slides, you saw like a picture where the Prime Minister was trying to give out things. That is Kamwenge, that's our silver. So instead of giving them, like the services, they give them kabuts and how can you give someone with the condition? You give them kabuts and salt. Okay, salt is meant to, just to manage the pain, but it's not sustainable. Because these people need to, and first of all, we need to even prevent the condition than having it, because it's a chronic condition. So you have a population which is unproductive. Yeah. Just because of the missing gap of information. And for the treatment right now, currently, because just like this project, Uganda, you have suffered with, because it's easy. That's why like we're trying to scale it up to like other hospitals, so that like other medical professionals get to know how to handle these cases. Because most of the people we have dealt with, they normally tell you we have tried hospital, we have sold everything we have, but nothing is being done. And the science these traditional healers use is when they have those cuttings.
Cut.
Because when we all know it's
The fluid comes
yeah,
out.
so
Yeah.
when the fluid starts coming out, they tell you now
It's okay.
it's okay,
That's right.
you will get better. But during the course of the time, they more infecting the wound and all that, because you're having open wounds since the lymphatic system is already damaged. So healing and all that takes time. And since most people like we're dealing with people like in rural places, like we all know the hygiene sometimes, even the areas and like for example like Kamwenge, We were surprised even during the camp, we even had to buy water for them to wash their feet. So water is also an issue for them. So when they have issues of water and all that, so it also gets worse because we found, and even the missing like gap of information. These people are close to a park, so they think it's elephant dung that is causing that. But when the Ministry of Health went there, so the missing, like, okay, like the missing gap of information is really what is causing all this. So as we are trying to achieve this mission, let's first, I think, push the information because it's very hard to pick someone who has, now, for example, an example of a patient, I think they can't even have the picture there. She came and she was like, the co-wife and all that, and all that. So after, because normally this program runs for 5 weeks, mostly, like for the severe cases, but for the mild cases, like the sisters who came, they only came around like thrice to the hospital. They used to come just once in a week or twice, and then now they're self-managing themselves. And that's what we want to teach, self-management, so that people can learn how to self-manage. Because most of the management, it's simple. It's all about the information. So after the treatment, we asked the lady now, so they even came and reconciled after, because they had to come to us and talk to them, because the missing up of information. That is really the challenge we have in here. But for the treatment and all that, we can have a program here, and by the time the program is done, everyone will know what to do. Mostly the clinical officers.
See, the funny thing about this management is it's so simple that you say, yeah, only this. But the funny thing that only this, you bring a person 1 week like this, and the leg you're already seeing the skin is starting to fall because the swelling is reducing drastically. So it's a very simple treatment that I try to encourage each and every one, whatever cadre, whether midwife, whether nursing, whether CO, whether M, or whether consultant, learn it, because you never know when you get a patient. You never know when you're going to get someone you're going to work on.
I'm a social worker. I'm not a medical professional like you. Yeah, so I'm the right of the organization, trying to organize and have a better program for. Because where I come from, I saw like first-hand information about for like these people. So when we're going to do the program, it's more organized. All these medical professionals to come together as we young people to come and do something for our country. Because when we were in Kamwenge, I remember Honorable Afan was surprised seeing young men and young women only us trying to, engage into this. But the only is the missing gap of information is what we're trying to fight. Because most of all these patients, most of them, we have walked through, like who have come to our camps, have gone through these things of the witchcraft, tea and share, those Chinese herbal teas and all that. But information is there, and it's very simple to manage themselves. Because, for example, the sisters who came for the camp, we only saw them 3 times. No, it's
I know them.
yeah.
Yes.
Yeah. And now they're doing managing themselves. So the whole instance is we want to scale up so that every medical profession should understand how things happen. I'm not a medical profession, but I know how to. I even help some people because some of them are hard to convince, but after giving them the right information, they believe it, and because when you try to give them like some of the signs that they go through, mostly like the acute, like those fevers and all that, and that's like the elevation. Because most of them, when you ask them when they're sleeping, they're doing well. But the moment they step down, that's when everything worsens. So when you give them such examples, they normally trust you and take up the information. So if I can do it, you can do it better. Because when a patient comes to the hospital and the medical profession is attending to them, they really feel like in the safe hands. Because you have seen this. Most of them, when you tell them like on streets, they really had belief. But when they find the hospital and you're telling them the same information, they will take it in. So our assistant medical directors then come to go with information. We have been on UBC, we have been on Next Radio, NBS, trying to give some information. But these things come with posts and all that. At least we are trying to push that missing gap of information. But at least even the medical professions, because even us, surprisingly, the camps like we had, we can come Wenge, because we have some of our recommendations, the work we have been doing. That's Kamwenge, that's the DHO in Kamwenge. Even them, they also had little information about it, like about the management. So let's not leave these people because it's a common condition right now with infections, recurrent infections, and mostly ladies, because most of the numbers are women, of our patients. So we need to push hard with the information so that we can easily tackle this condition. Because it's going to be hard to not like call them without giving them information about what they are having. Much like Etalo, people think it's witchcraft and all that. But this is cellulitis. It's a bacterial skin infection. But people need to be explained to and how it's handled.
How can we predict and how can we detect it and how can we prevent this condition?
Yeah, so, thank you very much, sister. Then that's when they're coming in with the information. Because when we give them the right information, we can easily prevent it from being it chronic. Because when it's in stage 1 and stage 0, it's easily reversible. But the moment it worsens, the lymphatic system is damaged, and remember the lymphatic system, it can never be repaired. Though we normally do some lymph node transplants, we have some German partners from Uganda University who normally come here and do those surgeries, but mostly it's only 10% of the patients who need surgeries. Most of them is just managed.
And also the surgery is not a cure, but there are patients who have extreme conditions in that the decongestive therapy itself is not enough. So that's where they would need a lymph node transplant. They get the lymph nodes from the person itself. They can get some cervical lymph nodes. They can get from wherever they are, good lymph nodes, transplant them in the leg. Now, if a person at least has 1 or 2 viable lymph nodes, when you do the congestive therapy, they get recovery much faster. Yeah, but like I said, once you get this, it has come. It is not going away. Yeah. So the only way to prevent, like I listed the causes earlier, is this seems like a bad way to answer, but basically avoiding the causes, because if it is heart conditions, kidney conditions, and all that, we know how to avoid those. If it is podoconiosis, whereby they are exposed to volcanic soils, yes, we treat them, but also wear shoes, practice proper hygiene. If it is trauma, obviously trauma now you can't protect yourself because you can go out and they knock you, but depending on those causes, that is how we try to prevent this condition. But then also if someone has gotten it, just like we made the stages, we can reverse it in the early stages, but we can only do that if people have the info, if they know what actually this is. And also if we as health workers are very informed, because they cannot blame anyone. Patient will come and ask you and you also have no answer. There's a patient in Mulago there. He had elephantiasis, but the only treatment they gave him, put the leg on a pulley for 6 months. It's like that, because that is what they knew to do. They didn't have the proper knowledge for it. But now imagine that patient got the proper decongestive therapy, or even got a lymph node transplant. It would be much, much better by the end of those 6 months. So it is very incumbent, even before we go to the public fair of a we need to really know these things, that a patient comes, we can ably explain and also manage them. Because if we give haphazard information or patient ajagamba, dogo. But if we give them a proper information and we are also confident in our management, people are going to come. you may not even, we can reach a time where we no longer even have to make announcements, and they know that this hospital, we can go there, manage. The other hospital has it, not just one place in Uganda is where they manage it from. And that is our major goal, that each and every hospital knows how to manage this, so that patients can come from wherever they are. Now a patient from Masaka or from wherever here shouldn't be going to Uganda, should be coming here for that management. Yeah. So I think my colleague can take over from there. Unless there is any other question, I'll beg to also sit go down and listen to you. Thank you.
No, for me, I don't have a lot to say because mostly it's a medical thing. That's why I wanted to say. Mine is comes to the social part of it, since I'm a social worker. So that's the challenges like these people are normally facing in the communities. It's upon us and even the medical professionals to come out and teach about this condition, because the challenge we had with these people, most times when they come to hospitals and they have no answers, they are very hard to convince, because when they come to the hospital, they normally think this is the last resort they have. Yeah, because when you normally come to the hospital and you fail to get an answer, you resort to our judges and all that, because that's where the people think they will get answers from. So we are kindly and requesting our collaboration here, so that we can, first of all, empower the medical professionals, so that you can have the answers to most of the questions these people have been having. And it's a bit, like challenging for this a kind of program. It's not a straight way program, because it's surprising, like patients may even come to the hospital and even fail to enter, because most of them they have been told the moment you reach the hospital and about Etalo and all that, or wait there. So the missing gap is the information. That's what we need to first tackle, and even between us and even the patients, because even us, the public and all that, we have little knowledge about the condition. So probably I think that's all, and I think we, Dr. Sarah, with the other engagements, we shall be engaging and see how we can have a program here. Yeah, but mostly I think my colleague has spoken everything. Yes, and with more information, because we have a lot of data, mostly pictures, because me, I normally believe in visual expressions.
Excuse me, sir. I'm still interested in learning more about that thing they call
Etalo, cellulitis.
Yeah.
Yeah.
Okay, I'm not a Ugandan, but I'm maybe to also believe that that thing is someone has been bewitched. But today you are bringing another insight.
Yeah. Yes.
Is that edema coming in an instance or is that?
So cellulitis, it's a bacterial skin infection. So normally, when it attacks the skin develops edema, what you call that swelling. That's why our organization is called Edema Support Foundation Uganda. For us, we support people with different kinds of swellings, not only lymphedema, but mostly the one of cellulitis, the one we call Etalo. So naturally, we all know that conditions people fail to understand here, people normally resort them to the traditional way. So the word Etalo means as Italo, because most times people could see someone with a swollen limb and all that, and they couldn't even explain. So
sympathize with them, they could just say Etalo. That's where the term Etalo came from. And with Etalo, normally we all know like how HIV came here, that missing up of information when it was lacking, people thought it was witchcraft, the same thing with HIV. So it took, like a lot of efforts for like to fill that gap of information, like for people to understand that like HIV is it's a disease, and this is how it is transmitted, and this is how you can avoid it. This is how all that comes around with it. So with Etalo cellulitis, generally here, because most of our patients here, I can show you examples of, I think Cancer see, okay, because there are some pictures that may not. A moment. So with mostly people think it's witchcraft, and sometimes we don't blame them because that missing gap of information. And even recently, the president was trying to explain it. There's a video of the president trying to explain it. He had a friend called, but down there in where we had gone to visit him, he found him with a swollen limb, and they're like, Bamuteze talo. And the science behind Utege talo, that's why like people normally say, Bamuteze talo, sikumuloga. Bamteze. What normally these people do, they normally get sharp objects and like dip them into concoctions that are like that create bacteria. They normally get like cow dung and even human, and they mix it and they keep it. So they pass through that like the sharp object. The moment it pierces you, because it's a skin bacteria infection. That's where it starts from.
So you must have got the
That's why they normally say Bahamuteze, meaning
that's the reality.
yeah.
I mean, take the beat.
Yeah, that's why someone say Bahamuteze sikumuloga. Like someone normally tells them like Bahamuteze talo. Because when you look at the traditional way, they also have some science behind it. Because just imagine someone trying to formulate bacteria and they use the bacteria in that way too. So there's some pictures that I have to show you here. One moment. I want to get the picture of the lady she was talking about, the one who was in Mulago. Exactly, this is it. So I think we all see this lady.
Yes.
Eh? No, but surprisingly, you can't believe we have worked on her and she's doing well now. Yeah, I'm going to show you the other pictures. This is the lady we're talking about, the one they had to elevate for almost 6 months. It's called Babia Jessica. She's a public person that has even been in newspapers, book trying to seek for help, like being taken to Germany and all that, but she failed because of finances. So this is how it goes. This is the back side. I think yeah, it was. This is it. This is the back side. The other one was the front side. That's the back side. So before she started the treatment, and she keeps improving. I'm going to show you. We even have another one I will show you, and she's a teacher. Couldn't believe it. So, and this no, she was not born with it. She developed the condition when she was around, was it 30 years? And that's only like around. So like this condition has, okay, I don't know how funny it is. It's like how malaria is for different people. Some, like how it treats like everyone differently. Even this condition, there's some people whose edema, that swelling, that edema, gets quickly in only a year. Some in. So it even depends on the skin and all that.
Genetics as well. If someone in their lining,
yeah,
they have people who had it, so definitely you're going to get it quicker than someone who has gotten it from other
causes. Let me get you another picture here, just because it's a lot of data we are having here. Because most of all these are patients we have been working on. So I want to get you those interesting patients, because with the mild ones, these ones are easy to manage. 2-3 weeks, some are even back home, some are even back to their work. Now, for example, you can't believe this was only 3 days. But she had spent almost like 12 years with a condition. She's called Sandra. And right now, she's tremendous. She works at a Kyengera supermarket in Tinda. I got her job because we want to have a program that after like supporting them, how do we bring them back to their community? First of all, these people are vulnerable people. By the time they reach that stage, they are unemployable. You understand? Most of them didn't go to school because of the conditions. Because like normally it develops at an early stage, even if it's a late stage, it will affect you like socially. So we need to bring them back to the society, like well prepared and all that. So after the management and all that, she was like, now what next? So like we even got her a job. So now she's working at Kyengera supermarket in Uganda, and she's tremendous in doing well. So such kind of like program, that's what we want to organize. That like you don't leave the patient hanging after treatment. Yeah, because most of these people, their families have neglected them. No one wants to know about them because they have also tried as a family, and they have, and that's when they resort to witchcraft. There's a Bahamologa. So most times this traditional healers bring in that concept of, I don't know, the stuff they use and all that. But your father has, sacrificed you for wealth. And when you try to look around, your father is rich and all that, and you're like, okay, I think it's true. So it's that missing up of information is what we want to first cover up so that it's easier. Because the treatment is very simple. As Dr. Elijah told you, it's very simple. But bringing these patients to the hospital to get these services because of the mindset, it's what we really want to change. So
do you have the center where you admit them and stay with them for those weeks?
So mostly we have been having medical camps. Yeah. So with medical camps, we normally have a camp that is different from these other medical camps. Because our medical camp is not a 1, 2, 3 day camp. We normally organize a camp for a month. Yeah. Yeah. So that's why the sisters could afford to come for almost like 3 weeks. Yeah, they would come once or twice in a week. We review them and all that. And now they're doing well. So we normally organize a camp that takes almost like a month because of how the condition is managed. It's not a one-time thing. It's gradual. And surprising, when these people start the hospital, they tremendously get better compared to the patients who are leaving. Because when they leave, some of them don't follow what you're telling them. So, but when you admit them, you stay them with them 2-3 weeks. By the time you release them back to the community, they are confident. Now, for example, the one we have just seen, that's Sandra. Sandra came on a Friday. We stayed with her on a Friday, Saturday, Sunday, Monday. We unwrapped the bandages, and that's how the skin responding that it was fluid inside. But the fibrosis she had, she couldn't even step on the border. Someone had to like, support the leg. But right now, she even tells you she can even kick you. I don't know if it's true because the interviews we have on Next Friday and then NBS and UBC, yeah, some of the patients we went with are testifying about it, and they're really doing good. But the challenge is the missing gap of information. Because most times when these patients come to the hospital, it's very hard for them, like, because like how we told you, it's simple. When they come, we normally tell them, okay, assess them and all that. When they start the program, vibration, massaging, but I tell them, you go walk, and they're like, that's all. They thought they are going to be operated, you know. So it's just manual. That's why we call it manual lymphatic drainage massage. Now, the one that they do, it's manually done. After then, we do the bandaging, and we tell them to walk, to go and walk, and even change of diet. So with lymphedema, and there's a condition called lipedema, but that one is a kind of easy. It's the one that comes with fatty tissues, where you find someone just even near sitting down, they feel pain. The one of lipedema. So that one comes with only diet and all that. And even them, even the ones of lymphedema, have to mind about the diet, because since the diabetic system has been like compromised, they need to boost up with that. So most times it's a bit challenging. It's a challenging program, but very effective. Simple with treatment, but the missing up is information. Because most times when you tell people, this is what we have done, like the work we normally show people, and they're like, is it being done here in Uganda? Because most people are seeing them across the streets. And even KCC is trying to remove them off the streets with this new campaign they're having in town, and they're not being helped. But the treatment is available. And the challenge is we are working with Bugema, like we saw referral from Kamwenge, is what we call our General Hospital, the one of government. But these are, like not like in the central, because most of the patients we have they're here in Kampala. And the challenging is, okay, the better part of this treatment is people stay doing their own work. They come for treatment in the morning, they go. Even tomorrow they come for the therapy in the morning, they go back to their work. Just to keep caution that, like after like bandaging, not putting the bandages. If you are like dealing in a hot area, try to reduce the times you are there, because already the skin has been, bandaged and all that. It will quite with some heat and all that. But it's very easy to manage. So most of the patients, it's just lack of information. That's all. Because the moment we give them information, they will come to the hospitals. That's why for us, our mission is to teach other different hospitals how can, how can they manage these people. Because since it's a chronic condition, even if we open up a center tomorrow, we cannot manage them. In Kamwenge, I can remember when we were in Kamwenge, when we called them, they came like 1,000+ people, and we even couldn't handle them. We only handled around like 100, and we had to, because first of all, the materials couldn't be enough for them. So it's a very big number now. We even have to have, even in schools, advocating for hygiene, mostly around the girls and the ladies, for sure. Because there's a recurring infection that are really doing them bad. Because when we're doing the assessment, when you ask them, did you get any accident and all that? They're like, no. But when you talk about the infections, most of them look down, shy about the information. And when you ask them, which treatment do you normally get? They're getting herbal medicine and all that. Instead of them coming to the hospital and they manage the, because normally when you have the recurring infection, they affect the lymph nodes. And when the lymph nodes are affected, the fluid cannot be drained and all that, so it complicates everything. So we need to even advocate for hygiene in public, the public toilets, hospitals, and all that, so that people know that hygiene is very crucial. Or else you may have a condition that you will stay with for the rest of your life. We didn't even come with we have a founder of the organization. She's a victim. She's called Kakoza Daphne. So she's one of the patient's advocates. But when we listen to her story, because this is like a young girl who comes from a well-off family, but they have tried everything, but they had failed. But right now, that's why she was like, you know what? I think I should come to the forefront of advocating for this condition. And